Okay, so Dr. Reddick is a pediatric neuropsychologist at Dell Children's Medical Center and serves as an assistant professor of neurology and pediatrics at Dell Medical School at the University of Texas at Austin. She specializes in conducting both inpatient and outpatient neuropsychological evaluations for pediatric patients with acquired and traumatic brain injuries, brain tumors, cerebrovascular disease, oncological conditions, hematological conditions, and neurodevelopmental disorders. Dr. Riddick is also committed to evidence-based and culturally responsive neuropsychological practice in her clinical, research, and scholarly works. She is consistently working on her own cultural humility, embedding culturally responsive practice within training, and speaking on how to translate theory into practice. So, without further ado, Dr. Reddick, I will hand it over to you. So let me go ahead and share, stop presenting.
Thank you very much for those kind words. I'll go ahead and get my screen shared now. All right. And can I have some confirmation that you are seeing the screen?
Yes, we can see the screen.
Okay, lovely. Well, thank you so much for that warm introduction. As Dr. Sun said, my name is Dr. Iman Khwaja Reddick, and I am very excited to be here with you all. And I want to start off by saying thank you for being here and for your continued commitment to learning and refining your own knowledge, skills, and attitudes around considering cultural diversity in your clinical practice. Today, I will be presenting on culture, a foundational variable in neuropsychological and psychological evaluations. I want to start by acknowledging and extending my gratitude to Dr. Jack Sun. I appreciated the safe space you created during our podcast interview and also greatly appreciate this opportunity to speak at the Multicultural Counseling Institute. I also want to acknowledge all those who have come before me and have paved the way for cultural neuropsychology practice. Regarding a position statement, the views expressed in this presentation are by me and do not reflect the position of my place of employment or the Multicultural Counseling Institute, its CE programming, or other instructors. This information is being presented from my cultural perspective, and that includes considering my diversity variables. For context, I'll share some of those with you today. So broadly, I'm a cisgendered heterosexual female. My pronouns are she, her. I identify as an American Pakistani, and I identify with both American Western individualistic cultures as well as Pakistani Eastern collectivistic culture. Regarding language, I have balanced bilingualism in English and Urdu, and I can read and understand some Arabic. Some other variables that intersect and impact my perception and experience of the world include growing up in rural Ohio, where my mom was an immigrant at the time and a physician. I had some interesting and challenging experiences growing up in rural Ohio with my particular diversity variables. So for context, I was raised in a Muslim household and came from a non-nuclear family and attended Catholic school while I was surrounded by the majority who were white, blue-collar, Christian, and Catholic nuclear families. So needless to say, early on, I developed a heightened awareness of similarities and differences between myself and the majority. Lastly, I do want to acknowledge some areas of privilege that I have. I come from a family where most have completed higher education. I myself am a doctor and am in a higher socioeconomic bracket compared to some of the families that I serve. And I'm married to a white American male, which has afforded me certain privileges at times that might be subtle to others, but are evident to me considering some of my lived experiences. So with that in mind, just keeping that at forefront, thinking about your own diversity variables and how that might impact your perception and how things might be presented in terms of the case that I'll review at the end. Regarding the learning objectives for today, by the end of this presentation, you'll be able to describe diversity-related concepts, including cultural neuropsychology, culture, acculturation, intersectionality, and language and multilingualism. You'll be able to understand and examine your own cultural humility, as well as be able to explain the competency model. And you'll be able to describe the eclectic framework and list all of its components. And lastly, you'll know how to systematically implement the eclectic framework to support culturally responsive practice based on your specialization. Let's begin with reviewing some diversity concepts. I will start with defining the subspecialty of cultural neuropsychology, because that's the lens from which I practice and from which I continue striving to improve my skill set in. Cultural neuropsychology is a systematic study of brain behavior relationships within the context of engagement in specific cultural practices that organize the development, maintenance, and revision of cognitive schemas and behaviors, and which reveals the relationships between sociocultural factors and cognition. That's a lot, but in summary, what that means is that an individual's cultural practices inherently influences and shapes their cognition, their belief systems, their perceptions, and schemas of themselves and the world. So, culture shapes and impacts cognition, and cultural neuropsychology takes that into account and conceptualizes from that lens so that the most reliable and valid data, conceptualizations, and interpretations can be made. So what is culture, this incredibly influential and foundational variable? Well, you all know what culture is, and it can be defined in various ways. A singular and broad view of culture is that it's a shared way of life for a group of people. Maybe a more nuanced, operationalized definition is that culture is a worldview that's born of learned and transmitted belief systems and value orientations that influence customs, norms, practices, and social institutions. And that includes psychological processes such as cognition and behavior, and organizations such as educational institutions. Additionally, with globalization, there's been a large interaction between different cultures and the impact on economic, political, societal, technological, and ecological elements. And that actually highlights that culture is not always necessarily stable, that it's in constant evolution. So, with that being said, it's clear that culture is a broad and complex concept that impacts every day of our lives. Moving to acculturation. Acculturation can be broadly defined as the similarity of a client's culture and experiences and adoption of the mainstream culture. So let's break that down a little bit. It's essentially a multidimensional process that involves the confluence among heritage culture and receiving cultural practices, values, and identifications. So as you all may know, there are 4 levels of acculturation. We have assimilation. This is when an individual adopts the receiving culture and discards their heritage culture. Separation is when the individual rejects the receiving culture and retains their heritage culture. Integration is when the individual adopts the receiving culture and retains their heritage culture. And marginalization is when the individual rejects both the heritage culture and their receiving culture. Now, a patient's level of acculturation can significantly impact test performance. Using language as an example, level of language proficiency in the dominant culture can impact test performance, particularly on verbal tests. So thinking about what this may look like in context, an average vocabulary score would have a different meaning for a patient who was born and raised in the US compared to an average vocabulary score for an immigrant for whom